Hello, everyone. My name is Dr. Missy Albrecht. I'm a doctor of physical therapy and owner of Invincible out here in Denver, Colorado. And I'm super excited to share something that I've really dedicated my career to here. And it is helping people move better from the outside in, but also the inside out. So, traditional physical therapy is that outside in joint muscle tissue. Inside out is really the importance of how our organs move and how they play into a lot of dysfunction and disease and pain. So, I got into this work because of a personal experience. I was in grad school and had lower back pain that nobody could figure out, and I had just gone through a massive nutrition journey and came across someone who did something called visceral manipulation, which is a lot of what we're going to be talking about. And they were able to get rid of my lower back pain by working on my intestines, which is just, even saying that out loud and sharing it with people, it's such a cool idea that that could be creating something that people struggle with all the time, lower back pain, right? And they think, this is something that I have to live with, or I'm stuck with it, or I just have to take this medication all the time. So, really connecting the dots is what I'm passionate about. So, very excited to share that with you all today. So, we're going to look at a few things here. We're going to look at the power of organ movement, and the goals are: why do organs even need to move? It's not really a concept that most of us think about or know about. So it's important to talk about that. What limits their movement? So, what causes that dysfunction? And then, how can we start to improve that movement? So, our organs are in perpetual motion. We, even just standing here, if we're not moving, our organs are always moving. They have these, they're called functional joints in between different organs, an organ and your rib cage, an organ and your muscle. And if you think of it like tiny little finger joints in between all those structures, they need to be able to move. So they move independent of each other. That's this mobility idea. So organs and surrounding tissue, your liver needs to be able to move independent of your rib cage as you lift your arm up overhead. And then there's this visceral motility. So motility is more the movement within the organs, and it's something that's happening as you just passively stand there. So it's this innate rhythm that we are born with. And in order for them to function, they must rotate. So if this fist here is your kidney, as we're just standing there, it has an axis of motion that it's just passively rotating back and forth through. Okay. So I'm going to play this video here because it is an amazing just visual of how our organs move, especially with breathing. So this is an MRI, and you can see as the lungs fill up, they're filling up with air, the diaphragm contracts and drops down. That's a muscle sitting right on top of here, and helps to push and move the organs down, just like that. With this nice stretch in the heart. So you can just see how everything really comes together and connects and works with each other. So if one of these structures has lost movement, and we'll go through how that happens, you can see how that can affect the breathing, affect the function of the heart, affect just other organs and other, just like a chain reaction. So Jean-Pierre Barral was the guy who discovered this visceral manipulation work. He has done some tremendous work, and he talks about how optimal health relies on harmonious movement of organs, fascia, and other structures, affecting the tiniest of cell movements to rhythmic contractions of the heart and blood flow. So just showing how the movement of the organs really affects at the cellular level. So, what causes reduction of this organ movement? So, a lot of people have heard of adhesions one way or another. Not my favorite word to describe it, just because there's a lot of people think adhesion and then they think the result is surgery to remove that adhesion. But this is more just a stickiness of a tissue sticking to another tissue and not moving well. So it needs to be able to slide and glide. So this image over here showing these organs, this white area is kind of that sticky area, that adhesion. And you can see how they can get stuck together. You can almost get a kink in the hose in your intestines. You can see how close the intestines are to the ovary, uterus, and just how everything can be intertwined. And this image is just a beautiful photo of fascia. And it's just this spider web network of tissue and showing how you can get just that stickiness that's not going to allow things to move smoothly. So that's one cause of reduced organ movement. Another one is just a loss of natural rhythm. So just like I was talking with that kidney, if we have some of the issues that I'll be talking about in a second, it's almost like a frozen organ. So it loses some of that rhythm. Maybe it only moves one direction. Maybe it moves kind of like a cogwheel versus smooth. So just a loss of that natural rhythm will change that function. And then a change in pressure system. So this can happen with damage to the lung. It can happen with any type of surgery where you're opened up because there's a change in that pressure system that holds all the organs in place when it's exposed to the outside world. Even a vaginal birth or using something like forceps can just change that pressure. So that's another common cause of that. Okay, so here's some things, a long list of things that leads to a reduction in the movement of the organs. This really cool image over here shows that our organs are designed to function with the human body. So when a woman is growing a baby in her belly, they're designed to move out of the way and then go back. So this isn't, it usually ends up being somewhat of a need for organ assessment postpartum because most people don't necessarily go into the pregnancy with perfectly moving organs. But just know that the body was designed, that this isn't necessarily a trauma, just having a baby. But you can see how, as the uterus is growing, everything needs to be able to move up and out of the way, which is really cool. So some of the things that are common to reducing these organ movements is a trauma during pregnancy or labor. So it could be something like a C-section. So a little bit more of an obvious kind of cut through the tissue, scar tissue is created. And it's not just that superficial layer that you see. They have to cut through a bunch of muscle, tissue, organs, move things around, sometimes pull stuff out. So that can be very traumatic just to the organs itself as well. When they're doing a vaginal delivery, and if they have to use forceps to actually just pull the baby out, sometimes more than just the baby comes out, there's other organs that will follow or at least move them out of position. So that's another cause for just a disruption in that normal organ movement. So when we look at these acute disorders, it's a little bit more of a compact or impact issue with the acute disorders. So you think of a concussion, when someone hits their head, the trauma is from the initial impact, but it's also because the brain bounces a little bit afterwards. So it's that domino effect of trauma. So the same thing happens to your organs. So if you're hit on the side, your organs are hit, but then they're also a little bit of back and forth hitting after. So that's a lot of the cause of like the whiplash issues, sports injuries, concussion, the seatbelt, same thing. So you get this intense tug or compression into your chest, and that doesn't allow, it creates that trauma. And so if that area isn't, if it's kind of frozen, we need to kickstart it and get it moving a little bit more. So then there's digestive disorders. So we've got bloating and constipation. That can just be a source of inflammation to the body that doesn't allow the organs to move well. It also compresses surrounding organs. So you can see if the intestines here are swollen, maybe the stomach doesn't have room to function properly. We've got nausea and acid reflux, GERD, which is another form of the in the acid reflux family, but it's a little bit more of a chronic issue. And just it's that acid dysfunction where maybe you're even bringing acid back up when it should be going down, or you're even sending acidic food into your small intestine, which can cause that bloating. Swallowing dysfunctions will affect that as well. And then we dive deeper into the women's and men's health. So any type of pain is going to disrupt this organ movement, because it's, as you know, everyone has been in some sort of pain. You just protect yourself. So there's not a lot of movement in your body in general, and that leads to maybe some limited organ movement in those areas. Endometriosis, fibroids, lack of menstrual cycle here. All of this stuff is very related to inflammatory issues, and that inflammation can lead to extra stickiness and extra just dysfunction in the organ itself. Bladder incontinence can be caused by a multitude of things, but can feed into that limited movement of the bladder. Same thing with the prostate, pain in the testicle, menopause just in general. And then we dive into some of these musculoskeletal disorders. So we can get this referred pain. Most people know, like when someone's having a heart attack, they're going to have pain into their left arm. So it's that referred pain. If they're having issues with their kidney, they might feel it in their lower back. And that is, we think of it from the heart attack standpoint, but if we look at it from a lower level where it's not that urgent of a medical issue, but something low level of low back pain and the kidneys just aren't moving, that's where we can kind of see that nerve connection between those two. Chronic spinal dysfunction, because you can see in this beautiful image how the organs are just sitting right on top of that spine. So they're all connected and need to coordinate together. Headaches and migraines because of just tension on the entire spinal cord and system. Carpal tunnel syndrome, joint pain in general, even in the neck and the sciatic nerve, is because when you have a little of restriction, a tug somewhere, if there's a nerve or a blood vessel involved in there, you could feel it elsewhere in your body as well. And then we dive into just the ideas that are a little bit easier to wrap your mind around: the scar tissue, post-op, post-infection, that kind of stuff. And then we've got some pediatric issues here, and then the emotional stuff too, which we're going to dive in a little bit too. So I kind of talked about this a little bit, but really important, especially with the reason that I got involved in this work, was lower back pain caused by my intestines. So if you look at this picture here, there's a tug. So let's call this tug over here a restriction in your large intestine. So you have some scar tissue in your large intestine. Maybe you had your appendix removed as a kid, something like that. So it could be tugging down your right leg here and causing knee pain on the inside. Could be causing hip pain on the other side. Maybe your left shoulder is being pulled down because of this tension over here. So I love this diagram to just kind of show how all of that is connected. And over here, I just mentioned a few of the common things that I see in my practice. Lots of unresolved lower back pain, a pinch in the hips with deep squatting because they Maybe they struggle with constipation and their hip flexors just are so crammed they can't get down very far, and they've done every stretch under the sun and it's still not improving. Same thing with shoulder overhead position. So if those organs aren't moving as you bring your arms up overhead, they it can lead to shoulder pain, neck pain, that kind of stuff. Headaches, we talked about a little bit with the tension in your spine and just the fascial connection all the way from your big toe up to your head. So can just be that extra tension in your system can lead to decreased blood flow, potentially leading to headaches. And then just unresolved pain everywhere else. I found in my practice, visceral manipulation is not the end all be all for everything, but it should be a tool in the toolbox. And it's an area that we don't necessarily focus on the movement piece. So it's a good area to be evaluated. All right. So now we get to dive into some things that you guys can start doing to start caring for your organs. So the first one here is posture. I love this quote by Lou Holtz. It's not the load that breaks you down, it's the way you carry it. So over here on the left, this is kind of where most people hang out with their posture setup, whether the chair is sucking you in, your couch, or it's just kind of habit. And so what happens when we're in this tucked position, we are slouching forward and we can't access our diaphragm. We can't breathe as well. We're almost compressing that area where our organs are. So that's not going to feed into any optimal organ movement. And then over here, you can see where I'm standing a little bit more upright and then where I'm leaning forward here. So leaning forward like this turns my glutes off. Most likely my core is off because I'm able to just kind of hang on my hip joints, hang on my lower spine. And then everything in the back, all the organs in the back are a little bit more compressed. Everything out here is just kind of hanging out, and it's going to actually change the function of the diaphragm as well, just in the opposite direction. And a little side note, this is a lot of times what feeds into that diastasis recti, which is when women's ab muscles during pregnancy, they naturally stretch apart, but maybe don't go back the way that they should because they've been overstretched through this posture here. Okay. Second one here is looking at your breathing. So a lot of times when people are retraining their breathing, they kind of think of this yogi belly breathing, which is great. It works on turning on that parasympathetic, that rest and digest, quiets your system down. And if you look at this diaphragm here, it expands. When we do belly breathing, it expands in the front here. But what we actually want to do is also the diaphragm follows all the way around, and we want to get a breath all the way around too. So what I want you guys to do here is you're going to grab a strap, and ideally it's going to have a little give. It's not going to be super tight. And we're going to actually wrap it around the bottom of your rib cage. So I'm going to have this right at the base of my rib cage. And this is just going to be some feedback. Okay. So I have this wrapped here. And what I want to do is I want to breathe into every part of this strap. So I inhale, I get a breath in the front, a breath out the sides, and then the back as well. And as you do that, you'll notice it's pretty darn easy to get this front area. It's not too bad. Some people are a little bit more chest breathers, but the harder spots are more this side and back. So just trying to lead more air in that direction is going to help to start train that diaphragm all the way around so that we start to get a beautiful massage of the organs on that backside as well. If this is challenging, you can also lay on your back, and getting some gravity out of there, or not having gravity push at you from this way down, will just make it a little bit easier to learn. So that's a really good thing to start practicing. It'll still turn on that rest and digest, but we really, even if we want to turn on that sympathetic and get ready to go for a competition or a run or something like that, we want to be breathing all the way around. And you'll notice the back area is going to be a little bit more challenging, but this is just because your spine is there. Okay. Well, not just because. It's hard because most of us don't use it, but it's also just going to be, it's never going to be equivalent to the front because you've got a bony structure in the back, softer organs in the front. So don't think of it as having to be equal. We just want a little bit more in that back. Okay. Squatty potty. Most people have heard of this lovely thing. So the cool thing with the squatty potty is it's taking us from this sitting position on the toilet where our hips kind of at this 90-degree angle. And there's actually this muscle here, this tissue that's actually pinching off the end of our intestine. So this doesn't make for smooth bowel exit. This makes for maybe not eliminating fully, maybe having to strain to push out. And this is the traditional angle of most of our toilets. We've kind of raised them up slowly over the years to keep people safer, because we sit so much and a deep squat is not very comfortable. So the squatty potty puts your hips at a higher angle. You put your foot just on a stool or the squatty potty, and it allows that muscle around the end of your intestine to relax so that you can eliminate fully. So this is just a game changer for everything. And one of my other favorite things that I love doing is just sitting in a deep squat position. So most people who struggle with having a regular bowel movement in the morning is because they get up and go. So like there's no slow down time. And so sitting in this deep squat, whether you're drinking your tea or coffee, hot water, sitting in this deep squat position, not on the toilet, just on yoga blocks, or I've got pillows here. And just being in that position really prepares your body well for the bowel movement. So you can do 5 minutes, 10 minutes, whatever your body is comfortable with. You want it to be comfortable because if you're straining because it hurts your hips or your knees or your lower back, you're not going to get the same benefit. So if you have to sit on a higher surface, that's fine, like a step. Just getting in a deeper squat position will help prepare you for that bowel movement. All right. So here we are with internal environment tips. So nutrition is a huge, huge piece. This is not my specialty, but just making sure that what you put into your body is feeding good things, is fueling good things in your body. If I'm working on someone's organs, but their nutrition is all processed food, we're only going to get so far. So nutrition is a huge thing. Medications as well. You know, a lot of these are necessary in the long term, or even in the short term, but just starting to really work with your doctor about being more intentional with what you're taking and why, and do you need it, that kind of stuff. Same thing with supplements, getting the right supplements for you. There's not going to be a perfect routine for everyone, but that's another way to help with this internal environment. I am a big proponent of essential oils. I work with doTERRA, which is a high quality company, very pure, very potent. And the reason I got into essential oils was I started seeing patients coming to me taking a lot of pain medication. So, you know, they'd be taking Tylenol, Advil, ibuprofen, just because they were in so much pain. But this stuff starts to really wreak havoc on our stomach, our liver. And so I was finding their organs were they weren't responding as well as they should have. So being able to reduce some of that stuff or get rid of it and use a plant medicine to be able to help with pain is just amazing. And it kind of ties into this reducing toxic load. So reducing those medications that you don't necessarily need to be taking and finding more natural options so that we give our organs a chance to heal and recover. But this toxic load is also, what are you putting on your body, your skincare, hair routine? What are you breathing in? Candles, air fresheners, those scented plugins, that kind of stuff. All of that stuff gets into our system and will create a heavier load on our organ system. So we really want to just be aware of that kind of stuff. Okay. Here we're going to dive into a little bit of emotional health. And the reason this is so important is when our brain is just either overloaded by little things or one massive trauma, our organs actually work as a receptacle to store excess. So the brain's like, hey, I can't take this anymore. Liver, can you take this? And so a lot of times we'll actually have stored emotions in our body, maybe because we didn't process them fully, we didn't give ourselves that space, or we just really need to slow down. And a lot of the things in our life are leading to more stress reactions that cause more stored emotions. So I love this photo because it's basically like a garden in our brain, and doing things like eating well and sleep and having those stress management techniques, it's basically helping us manage our garden better. And especially with the sleep piece, there's actually pruning, or we'll call it weeding, pulling the weeds out that happen when we sleep. So if we're not getting that high quality sleep, a lot of times the weeds and the plants get overgrown, and that's when our organs may be taking over some of the other stuff. So taking care of the other parts of your routine and self-care is super important. But there's another way that we can kind of work through some of these emotions stored in the organs. So I have a ebook here that has a really good resource for using essential oils, different affirmations and thought patterns that can really help you work through. Each organ kind of has a emotional pattern that is commonly seen with it. So pancreas is unresolved grief. Liver can be anger. Gallbladder can be worry. Stomach can be how society sees you. So there's just different really interesting things, and it'll allow you to reflect. And, if you're always having bowel, like bloating in your intestines, maybe you can look at the emotions related to that and see if it connects the dots for you. Okay. So here we've got the Corgus ball. This is where we can get into some self-massage for the organ movement. So I'm going to play this video here for you guys. So here's where we dive into some of the self-massage using the Corgus ball, or again, if you have a lot of Pilates balls, bar 3, something soft, and also something that's not going to pop. So not the best thing to do with your kids' bouncy ball from Target or something like that. You can also roll up a towel, sweatshirt, something like that to get started with this. Again, I just love how grippy this is and how much it mimics some of the work that I'm doing. So we're gonna actually start on your side, and you're gonna lay in between your last rib here and your pelvis. So I'm gonna lay, and this is where we get to get our calendar pose on. So what helps me completely relax my belly on this ball is bringing this leg forward. So if that's comfortable for you, and all you want to do is literally just let everything fall onto the ball. And I'm going to take some deep breaths here. So as you guys are doing this, if you hit a spot that is
really intense or just a position that's really intense, please get up and move. So a little bit of discomfort's okay, but if we lose that good quality breath, all you're doing is sending your body into shock mode, and it's not going to be beneficial anyways. So there's modifications that we can do for all of this stuff. So you're just laying here. Take a minute or so, breathing deep. You can roll a little bit back and forth. And then you're also going to do that with the other side. Take note, differences side to side, tenderness. You can kind of wiggle a little bit. And then if that feels like enough work for you, you can stop there. Otherwise, we're going to go directly onto your belly like this. So what I like to do here is relax my forehead on my hands like this. And it takes some time to allow your body to let a ball in, because most of us have not dug into this area before. So give your body time to just settle on the ball. Taking some belly breaths. And then once you feel like your abs, your belly is letting the ball in, you can come up onto your forearms. So allow your abs to be nice and relaxed. If this is starting to get too intense, go back to the side. But here what I'm doing is I'm rolling side to side, up and down. You want to make sure this is all on skin. I can start to get a little bit more creative. I can come up like the Little Mermaid, twist side to side. I can put my hip into different positions. So you can get a little bit creative here. Okay. I would spend maybe 2 to 3 minutes on the front if you're there. If you're not, we're going to the side. If you can't do either, or you just had abdominal surgery in the last 3 months, I would recommend going up against a wall. And this is where you can use a more fragile, softer ball, like your kids' toys or something like that, because you're not putting your full body weight on it, but I can still get some relaxation.
So that was just a nice little kind of intro into how to use one of my favorite balls. It's just been such a game changer for my patients to be able to have that take home self-care tool to manage stuff. It is not working. It's not replacing the visceral manipulation. If you think of all your organs being placed into a Ziploc bag, this is working more the Ziploc bag area. Whereas my hands, or a visceral manipulation practitioner, is going to be more specific actually on the organs. But it's a great, great thing. All right, last but not least is this visceral manipulation. So I love having this definition up here because I think a lot of people think it's a chiropractic adjustment for their organs, and it's just a very gentle technique. So there's no quick manipulation. So it's a gentle manual therapy that assesses the structural relationships between viscera, your organs, and their fascial or ligamentous attachment to the various systems. So this is kind of what we've been talking about, right? Getting things to move. It also assists with functional and structural imbalances throughout the body, including musculoskeletal, vascular, nervous, urogenital, respiratory, digestive, eliminatory, neuroendocrine, and lymphatic dysfunction. So it's starting to bring our body back into balance. And you'll see in this picture with a patient, your body's in different positions because it just helps me to access different organs. So here I'm able to utilize gravity a little bit more to get a little bit more work on the liver. And this quote up here, an organ in good health has good physiologic motion. So hopefully you guys have a little bit of a better idea of why organs need to move, what causes issues with that, and how you can start to improve that. So I've got my website down here, stayinvincible.com. There's a really cool interactive organ diagram on here that you can kind of click around through and learn more about the organs. I work locally in Denver, so you can book through that. I also am set up to do virtual appointments. And then I left this website over here. The Baral Institute is where I've done my training through. And if you're not local and you really just want to get an in-person assessment, you can search for a practitioner in your area. And last but not least, please don't hesitate to reach out with questions. This is my email. I would love to answer any questions you have and kind of talk you through this piece of health that I think a lot of people are missing. And it's been such a huge game changer for my health and the patients that I've been able to work with in the last 3 or 4 years. So excited for you to get started, and let me know if you have any questions.